Hi, welcome to this video. We're going to be going over chair massage in this one. Obviously there's nobody in the chair yet because before we get started we actually should be talking a little bit about setting up your own massage chair. The main points that I want you to remember is that no two massage chairs are alike. Every single chair that you see out there is probably a different model. So I'm not going to go through and show you how this chair is set up because it's probably not going to help you set up your own chair. But what you should keep in mind is this. You should know how to, of course, how to unfold and repack your table. The main things you want to keep in mind is that the low pads are where their shins are going to rest. This is obviously where they're going to sit. And then this is where they'll set their arms classically. When we have, most of the adjustments that we can make are usually in the chest pillow and the faceplate. The chest support, you want to make sure it's not too low. If it's too low, it can really cause them to hunch over in the chair. Likewise, you also want to try to make sure that your face cradle isn't too low because it'll cause them to turtle their neck a little too much. So we want as much as possible for their back to be able to extend and be tall, and for the chest to be supported by the pillow. So again, as much as you're able to, try to make sure that the chest support is towards the sternum, not too low, and also not up at the neck. Bring it down if you need to. And that the face cradle itself, it also sits squarely across the forehead as much as possible, so you don't, if it's too low, they'll have to squash their neck. If it's too high, they'll oftentimes be kind of letting their neck fall forward. All right, great. So we have our client in the chair. The first thing that we're going to be doing is a series of palm presses down the back. Now, before I get started, I just want to mention really quickly that for the purpose of our chair massage, we're pretty much always going to be in a bow stance. So in case I somehow forget to call that I'm in a bow stance, just remember everything that we're doing is essentially in a bow stance. So as we get started with our palm presses, I'm going to go ahead and take a bow stance facing directly towards the client's back. And I'm going to go ahead and lay hands over the client's shoulders. And we're going to do a series of light compressions going from the top down the back. And we're going to use, think of it as like a compression. We want to go in and not bounce in. Notice as I'm going lower on the back, my stance is getting low. What we want to avoid is either having our wrists really sharply bent like this or hunching over in the back to go to these low spots. So as you get lower, to keep your wrists as relaxed as possible, go low in your stance. And we're only going to do these palm presses to about the low thoracic. We're going to avoid that pressure over the lumbar. Once we've gone down here, we're going to go ahead and step off to the side, bow stance going across the client diagonally. I'm going to take my inside arm, the one that's closer to the client, and I'm going to use the heel of my palm to do a medium knead over their erectors. Notice again, I'm using my stance to do this movement. My elbow isn't moving because my legs are doing all the movement. And I'm using the heel of my palm, but my fingers in my hand is fully relaxed onto the client's back. So again, as I go low, my stance squats down low to get to these spots. And once we've done our medium kneads all the way down, we're going to do thumb circles back up. So I'm going to switch my stance to straight forward, and I'm going to use my stance with my thumb to create pressure and little circles going all the way back up. Now once you finish the first side, you'll just do these two moves on the second side, medium knead and then thumb circles back up. Once we've done both sides, the next move is going to be a crab grab, where basically we take our thumbs and our fingers and we're going to flare them out. The thumbs are going to be on the center of the back, the fingers are going to be at the sides. Using our stance, we're going to grasp and push in with our stance and then release, go down, grasp and push in, all the way down the back. Good, we can even thumb circle our way back up. Once we've done this, we'll be ready to do the next set of moves, working on the shoulder. Great, so the next few moves that we're going to be doing is a series of press rubs on different spots of the body on the shoulder. The first one that we're going to be targeting is going to be we're going to shift our stance for the first time to be essentially in front of the client, looking down or back across the body. I'm going to use my bow stance again, looking in the same direction as my push, and I'm going to use my thumb to target the supraspinatus. So I'm going to look to kind of sink into that spot, going deep to the trapezius onto the supraspinatus, and press rub here. If you'd like, you can look for a couple of spots in this little area. When you're ready to move on, we'll move to GB21 or gallbladder 21, sometimes called the shoulder high point. You can find it by tracing the trapezius, and where it starts to rise up towards the neck is about the right spot. So we'll go ahead and put our thumb here. Now my thumb is straight with the wrist, And when I push, I'm not pushing through my shoulder. You can see again that I'm using my stance to create this movement. My thumb does do a little bit of circling here to kind of stir the pressure around though. Okay, once we've gotten GB21, we're ready to move back, facing the back of the client once more. We're going to come across at a diagonal, and I'm going to use the next spot we're going to target is the infraspinatus. So again, the thumb's mostly straight, doing just a little bit of circling. My stance is providing all the pressure here. And infraspinatus has a good amount of area, so you can kind of move around, testing different spots, looking for good spots for your client. And when you're ready, we're going to move on to press rub a couple spots on the axillary border of the scapula, where if you're familiar with it, we're going to be looking for small intestine 9 and 10. If you're not familiar with those points, you can pretty much just kind of hook under the back of their armpit and look for a high spot that's right on the side of the bone. Once you find those spots, again, using your thumb and your stance, go ahead and do a press rub. And about 1 thumb's width below the first spot, you can find a second spot, which will be approximately SI10, and press rub there as well. Great. Once you've done those 4, you can go ahead and do them on the second side, and you'll be ready for the next set of moves. All right, great. So we're going to address the back one more time before we move into the arms. To begin with here, we're going to go ahead and use our ulna to make compressions in the back. We're going to look for spots between the scapula and the spine. Avoid touching the scapula or the spinous processes with the elbow. Look for the soft spot between them. When you're doing this, you want to treat it a little bit like deep tissue. Try to sense and follow the client's breaths. When they are exhaling is a good time for you to add pressure in. While you're doing your elbow compressions, feel free to change your bow stance very lightly to change your vectors. You can also lightly change the rotation of your humerus to kind of bring a little change into the vector of your ulna or your elbow as well. When you come out, try to come out slow. Depending on how much time you want to spend here, you can spend quite a bit of time if you're really working that kind of deep tissue aspect. In general, though, I would say try to keep yourself moving. Don't let yourself get dragged down too much in these compressions. Remember to kind of change your vectors using rotation as you can. Okay, coming out of that last one. Once you finish your elbow compressions on one side, we're going to go ahead and come up to the neck. From here, we're going to go ahead and just do a knead behind the neck. Now, if they have a face cradle that's holding their head, you don't need to worry about it. If they were laying on a table, I would bring their head up and I would support their forehead with my hand. In this particular case, we're using the chair, so they're well supported here. So I'm just going to go ahead and create a nice broad knead for the back of the neck. Great. Once you've done that, we actually are going to ask our client to go ahead and bring their head away from the face cradle. So go ahead and sit up a little bit more straight. We're going to take one of our hands and we're going to support the forehead. The other hand is going to grasp behind the skull at the probably just below the occipital ridge, and you're going to grasp and squeeze, pushing the head forward and then lifting the forehead back, and we can do this a couple times. When you're ready with that, or done with that, you can go ahead and bring the client back forward again. Next thing that we're going to do is create a bow stance facing directly at the back of the client. We're going to grasp over their trapezius, and using a gentle pinching motion, we're going to create a little circles here. Once you've done that gentle pinching circle over the trapezius, we're going to transition into using bilateral thumb circles, working our way down spine. And once you've worked your way down the spine with thumb circles, we're going to crab grab our way back up. And lastly, we're going to grasp over the shoulders, and this is where we transition into our arm moves. All right, now that we're ready to work on the arms, what we're going to do is come around to the front side of the client again. We'll go ahead and take one of their arms, and we're going to grasp the hand like we're giving them a handshake. Once we have their hand firmly grasped, we're going to go ahead and gnaw our way down the shoulder and the arm. You can just think of it as kind of using a grasping knead, and where you can either gnaw or knead along the large intestine meridian if you're familiar with it, or otherwise you can just kind of feel along the forearm for some good spots. Anything that feels tense you might spend a little bit of time on. Cool. Once you've come down to the hand and the wrist, we're just going to take some time to grasp and knead on the wrist and the hands. Good. Working all the way down and out to the fingers. Cool. Once you've got the hand worked out, the next thing we're going to do is we're going to grasp in the webbing of the hand between the punching knuckle and the root of the pointer finger. We're going to press into the webbing and onto the pointer finger at large intestine 4. And we're just going to lightly press rub here for just a little bit. And once we're done with that, we're going to go ahead and just grab the hand again like a handshake, and we're just going to go ahead and kind of weave the wrist, create a light shake. We can bring ourselves out a little bit more and kind of snake the arm back and forth. Once you've done that with the first arm, just go ahead and continue to do it with the second, and then we'll do our last 2 moves to finish the recipe. Great, so we're ready for our last 2 moves. The second to last that we're going to do is going to be a scalp rub / scratch. Just make sure that you have the client's permission. Some people don't like to have their hair mussed with, but I've already gotten permission to do that. So I'm just going to go ahead and take a light bow stance, looking down towards the head of the client, and just going to go ahead and use my hand and kind of get my pointed fingers. Even though I don't really have much in the way of nails, I'm going to use my finger points to kind of bring in almost like a scratching, rubbing kind of a movement. And I can bring that across onto the sides of the head instead of just staying over the top. And again, just kind of looking for good coverage, kind of like you were doing a circulatory recipe. You want to get everything to get just a little bit of attention. Cool. Once you've done that, last thing that we're going to do to kind of wrap this chair massage session up is going to be some percussion and brushing. So I'll come back doing a bow stance towards the back, and we're just going to go ahead and do either cupping or light tapping or pounding across the shoulders, down the back, and we can end with a little bit of brushing. And you can finish the chair massage. Now usually the first time that you do this one is going to take a little bit longer. Once you get comfortable with doing all these steps and knowing what's coming up ahead, oftentimes we can do this recipe in 15 to 20 minutes or so. So we'll see you next time.